Welcome back, this is Paramedic Project. Thanks for joining us once again today, talking about a really important aspect of patient care, and that is positioning your patient well. Now, some people might think that this is a minor detail on scenes, but literally it can be the difference between a scene running really smoothly and you making things really difficult for yourself on these scenes. So let's look at some of the key points, in my opinion, about positioning a patient. First of all, you need to acknowledge that the gear and the equipment you're carrying, you need to see them as anchors in this situation. So the more gear we put down around the patient, the harder it is to rectify that poor patient position. Those bits of equipment really anchor you to the spot where you are and where your patient's at. And to rectify it, to make sure it doesn't happen in the first place even, we need really, really good early decision making on scene. We've talked about assessing the patient on approach to the patient. Part of your assessment also should extend into the position of the patient, where they are in the room, how they're positioned, and where you have to move them to then give you 360-degree access to the patient, which is my next point. We need 360-degree access to this patient to be able to give them the best patient care possible and to really give them the care they deserve. So they're the three big points. First of all, good early decision making on approach. The patient's been walking the room. We're seeing the patient in a poor position in a corner up against a wall. We can't access the left side of the patient. We need to make a decision before we get to them, before we put our gear, our anchors down, that we need to actually move them out into the middle of the room. And if this room is really cluttered, we need to move them maybe into another room, out into a living room, to give us the third point, 360-degree access. Side note on that, of course, when we're moving a patient, we need to move them gently. We need to be aware of spinal cares. We need to be aware of injuries they may have sustained. So we need to be aware of that whenever we're obviously touching and moving a patient. That's a side note. So the three big points. Hope that's really helped you. Patient positioning, it's a really important part of our care. Find us on social media. Join us next time. It's been Paramedic Project.